Vitamin D is made from cholesterol. It's converted to bile salts in the liver. Let's go over some of the lipoproteins a little bit. HDL is synthesized in the intestinal epithelium during the absorption of fatty acids from the small intestines. So they like to call that the good cholesterol. There's a very low density lipoproteins, VLDL, that transports triglycerides to the fat tissue throughout the body. LDLs and intermediate density lipoproteins are especially important in different stages of phospholipid and cholesterol transport from the liver to the peripheral tissues in the form of, or from the peripheral tissue back to the liver. So it could go either way. It could go out from the liver or back to the liver. There's nothing good or bad about that. It's just cholesterol being metabolized. That's an important needed nutrient in almost every cell of the body. It's like saying I have a little too much blood. You know, I make a lot of red blood cells because I exercise a lot and I breathe a lot. Well, if you don't have, you know, hemochromatosis, that's good. If you do have it, that's bad. I mean, this isn't a disease, having a little bit too much cholesterol. It's just a form of stress. So there's just interesting things that the pharmaceutical companies do to help sell medication. Although lowering serum cholesterol does seem to decrease deaths from heart disease, it does not, in the least, improve overall mortality rates, according to the Journal of the American Medical Association. People who achieved lowest cholesterol levels, 160 units or less, had unexpectedly higher rates of death from other causes such as liver cancer, stroke, lung disease, alcoholism, and suicide. Here's some of the reported side effects of statin medications and cholesterol-lowering medications. Chronic aches and pains of joints, progressive cognition, memory problems, confusion, mood problems, depression, dementia, impaired or slowed wound healing, numbness, tingling, swelling, weakness, impaired immune function, increasing fatigue, decreased stress handling ability, impotence, demyelination disorders like ALS and MS, liver damage, shortness of breath, increased incidence of heart failure, increased susceptibility to degenerative processes. So, okay, Warren. So maybe it's not quite as good as the drug companies would have us believe, huh? Anyone ever heard of bromelain? Okay, let's just go over this from a common sense point of view. Okay. Sometimes I can't even behave myself, even if I'm talking in public and people are listening to me. I can't believe you guys have to listen to me. No, I'm just kidding. Okay, so this is what we get from statin medications. Anyone ever heard of bromelain before? Okay, somebody has. A bunch of people raise their hand. It's an enzyme that comes from pineapples. It helps with inflammation. Anyone ever heard of curcumin or turmeric? Anyone ever heard of L-glutamine, vitamin E, vitamin C, beta-carotene? You ever heard of manganese? Have you ever heard of glucosamine, the drink? Okay. Have you ever heard of, I don't know, trimethylglycine, dimethylglycine? Glycine. Okay. Have you ever heard of taurine? Okay. Have you ever heard of folic acid? Selenium. Okay. Well, I'm glad that you've heard of these lovely nutrients. Did you know that almost all of them are just as, if not more effective than the statins that cause all these side effects? And I don't think you should necessarily take all those things all the time, but they may at least be safer than statins because they don't leave residues that are toxic in your system, to the degree at least. So, you know, I mean, it depends on how you look at things, but I think a nutrient deficiency should be addressed by giving nutrients. It's not necessarily a drug deficiency, like they might lead you to believe. But if I have restless leg syndrome, obviously it's because I don't take enough drugs, so I'll just go take some drugs. Okay. If I can't get an erection, then I have a Viagra deficiency. If I have a headache, I have an asthma deficiency. If I'm annoyed, I have an antidepressant or an anxiety deficiency. If my son can't pay attention in school, they have a Ritalin deficiency. If I'm obnoxious, then I must need Prozac. If I can't pay attention, I have ADD. I probably need, you know, something. There's a pill for every ill. Right? It has nothing to do with exercise or diet. It has nothing to do with their lifestyle. 56% of Americans worry about fat and cholesterol. 45% think that the food they like is not good for them. 36% have guilt feelings when they eat food they like, and the cholesterol campaign is medical quackery in the first order, according to this expert medical doctor who wrote the book. Okay, this is fun. Yay. So a bad diet, too much cholesterol and saturated fat, could lead to coronary heart disease at some point, but first there's going to be the high blood cholesterol. It's the theory. This is a theory. This is a myth. And then you have the high blood cholesterol that leads to cholesterol that blocks arteries. Right? Just clog up the arteries got all blocked, and you like have a heart attack and die. Right? But the Maasai, they're just really healthy. They're the most competitive athletes on the planet. Their cholesterol's fine, but they're not dying. They're doing pretty good, but yet we're trying to be convinced that all of a sudden cholesterol is going to build up and you're going to die, especially if you eat too much of it. Do you guys get it? I mean, this is what, no offense to anyone who's selling, who's a pharmaceutical rep. Pharmaceutical reps. Come on over. Has anyone here ever heard of bromelain? Anyone here ever heard of manganese? Are we going to talk about inflammation and what to do about it? Okay. All right. Let's just talk about inflammation and what to do about it. So the Triad of Health is all about structural, chemical, mental, emotional therapies and methods of addressing the causes of cholesterol. So we probably want to have something to do about it. Open-ended system of checks and balances. So how do these structural, chemical, and emotional components of the body, how are they related to cholesterol metabolism? The answer is, they're intimately related. Those are the things that cause cholesterol levels to go up or go down. If you're worried about your divorce, or whether or not you're going to get a raise, or whether or not you're going to get the car payment paid on time, your cholesterol levels go up, you're under stress, right? That's emotional. If you decided to cut off my finger, I'm really going to be upset. Thank you so much for not doing that. I appreciate it. But, sometimes I'll have patients who come in from an accident or something, that's a structural problem. So that'll cause your cholesterol levels to go up. Sorry, I got excited. If you have, if there's chemtrails and barium coming down from the sky because somebody thinks that the weather's going to improve because of that, then that could possibly raise cholesterol levels because it's a toxic thing that can cause inflammation in the body. There's a lot of causes of inflammation. Anybody here ever eat nuts or seeds or spicy food, alcohol, chips, caffeine, popcorn, almond butter, peanut butter, cashew nut butter, chocolate, or beans or rice? Anyone? What about wheat, dairy, corn, soy, processed sugar? Did everyone, if they did, they all got the handouts, right? Okay. Yeah, so after a while, we're going to collect the handouts if you're excited about what we're talking about. You can always come into the office and we can maybe sit down together and we want to find out, if there's something we can do to help you. These are the kinds of things that, what was your name again now? Linda. So Linda's side of the room is a little ahead. Actually, they're way ahead because Warren took off. Warren was like, I'm out of here, man. My cholesterol levels are, I don't know what to do. Thank you, Linda. I appreciate it. So we have all these therapies, I can't get too close, but all those therapies under structural that address the structural causes of cholesterol being off. All the therapies under emotional that address the emotional causes of cholesterol being off. And all the things under chemical that address the chemical reasons of cholesterol levels being off. What do you see at the bottom of them all? Professional flight kinesiology, right. Okay, thank you. You would like all, okay, you guys are great. So, muscles is what an applied kinesiologist specializes in. Did you guys know? Check it out, like each muscle in the body is related to a different gland and or organ. If I'm talking too fast or if you have a question, it is okay to raise your hand. I'm sorry if I didn't tell you that. I'm talking too loud? Oh, sorry.
Slow down.
So muscles are related to emotions, and muscles are related to bones and reflex points throughout the body. And did you want me to repeat anything? Or? Okay, thanks for letting me know. Right side of the room, man. You guys are awesome. No offense to the left side. You guys are touching out, but it just takes time. Everybody can be thankful for the right side of the room. So these are all the things that muscles are relating to. So there's all these different interrelationships in the body. And when you go to your medical doctor, usually, unless they have a training in acupuncture or applied kinesiology, they don't know about those relationships. So they're not really able to get to the underlying causes of why you're having your cholesterol be off. I mean, they can tell you to exercise or go on a diet or whatever, but they're not really helping people that way. They're just telling you to come back in 6 months and see what happens. It's just like an experiment, you know? There's no need to experiment. You can actually see changes in the body right before you with a whole system of diagnosis and treatment. So these are all the chemical things that cause the inflammation, Linda, right? Okay. So if somebody's 80% of the body's made out of water, so if you're drinking the wrong kind of water every day on the right, near the bottom, then that might cause some trouble with their cholesterol levels. You know what I'm saying? I'm actually having a lot of patients that come and see me and they have pesticides, herbicides, fungicides, milicides, all these different things in their water. These are the different therapies that help with the emotional causes of cholesterol going up. Wouldn't it be cool though if you could just find somebody who did all these things? That's what I was saying, like you can kind of look into a crystal ball to figure out what therapy do we use for what person in what order to get the very best result. It has a name, doctors like names like critical point analysis, which means you get the best result from the least amount of input in the fastest amount of time. So the tenet of homeopathy is that the master healer heals swiftly, permanently, and safely. So that's kind of what healthcare is supposed to be about. We're not supposed to give people medications that cause liver cancer. We're supposed to find out why they're having trouble with their liver or the metabolic processes or whatever is causing them to have the symptoms that they got. We're not supposed to treat symptoms by handing out pills or potions or lotions. I mean, it's nice to have a pill or potion or lotion, and it's nice for a symptom to go away, but we want to address the emotional causes like a psychologist or a psychiatrist or a marriage and family therapist is doing. We want to address the chemical causes, the way a homeopath or a naturopath or a licensed nutritionist or a person who balances the doshas using Ayurvedic medicine with you, or a microbiologist or whatever. We want to figure out how to do these things. Applied kinesiology does these things. It's not a miracle solution. Okay? It's about understanding the scientific facts. Okay? I got so excited I couldn't handle myself. Linda got me all excited. Linda, you got me all. We can go back in a minute to where we were at. But we're here to help. Looks like we still have a fair amount of time, so we're going to go back over a few things. And we're going to find out if there are any more questions in a minute. We got a question. Hi guys. I'll try to listen and repeat the question. Yeah. What? Okay. So there's no good, there's no bad, but let's talk about what they're referring to when they talk about good and bad.